we can see here that this is external fixator clamp. This portion is the Steinmann pin, and another thing there is rod. Steinmann pin. This is a stout straight steel rod of diameter ranging from 3 to 6 mm. It is used for skeletal traction, common sites being upper end of tibia, supracondylar region of the femur, and calcaneum. Now Steinmann pin, no threads, that is skeletal, used for the skeletal traction and compression arthroidosis. Next is the Denham pin, middle thread, skeletal traction in osteoporotic bone to prevent the slipping. Next is the Schantz pin, thread at ends, it is external fixators. Next, this is the Harrington's rod, blunt with threads at one end but each is far apart, spine fracture and scoliosis. It is used for spine fracture and scoliosis. Next, this is ras nail and hook for the extraction, one side bevel tip for easy insertion, indication in fracture humerus fibula, and disadvantage is chance of rotation due to circular cross section. Next, this is radius square nail. This is R-shaped. This is radius square nail. Now ulnar square intramedullary nail. This is ulnar square intramedullary nail. Now Kuntscher cloverleaf intramedullary nail or the K nail. K nail has one slot, one cloverleaf cross section, eye or fenestration, blunt hollow end with cloverleaf cross section and eye. Cloverleaf shaped to prevent rotation. Nails are devices used for intramedullary fixation of fractures of long bones. Some of the nails used commonly are as follows. First is Kuntscher nails. This is used for internal fixation of fracture of femoral shaft. Then Smith-Patterson nail. This is used for internal fixation of fracture of femoral neck. And V nail. This is used for internal fixation of fracture of the tibial shaft. Then ras nail. This is used for some special situation in long bone fracture. And K nail in details. Kuntscher, a German surgeon, devised the intramedullary nail for internal fixation of femoral fracture. This nail is a hollow tube with a slot on one side. It is cloverleaf shape in cross section. The fixation by K nailing is based on the concept of 3-point fixation, that is, when a straight rod passes through the carved medullary cavity of the femur, it fixes bone at 3 points at either ends and the isthmus. The cloverleaf shape is designed to give good rotational stability to the fracture. The nail has an eye at its either end in which the hook of the extractor is introduced while removing the nail. The size of K nail required for a particular case is found by determining the length and diameter of the nail required. The length is measured from the tip of the greater trochanter to lateral joint line of knee and subtracting 2 cm from it. The diameter is determined on an X-ray from the width of the medullary cavity at the isthmus. So here it is written that indication fracture shaft of femur and humerus tibia. Ideally, in a young patient, a fracture at the junction of upper and middle 1/3, narrowest portion, no communication, transverse or short oblique fracture. This is osteomore prosthesis. Osteomore prosthesis, this is used for replacement of the femoral head in a case of fracture of the neck of the femur. In elderly person, the prosthesis has a head with a small neck and a stem. It is available in head sizes ranging from 35 to 59 mm. There is a small hole at the top of the stem for the hook of the extractor used while removing the prosthesis. The stem has 2 fenestrations in the middle through which the bone supposedly grows and help in fixation of the prosthesis. The prosthesis can thus be used only without cement, because the use of cement would make its removal, if required, difficult. So another is the Thompson's prosthesis. This is a prosthesis for the head of the femur similar to the osteomore prosthesis. It is specially indicated in cases where the neck of the femur is absorbed. Example, in old fracture of femoral neck. It can be used with or without cement. This is bipolar prosthesis. Bipolar prosthesis has 2 heads. Indication same as the osteomore prosthesis. Now chisel and osteotome. Chisel and osteotome Bone chisel, it is like an osteotome except that only one of its surface is bevel. It is used for removing a protruding bone on leveling a bone surface. Example for leveling, excessive callus, removing an osteochondroma, etc. An osteotome, it is used for osteotomy, cutting a bone. Its bone edges are beveled. It is available in different widths of the blade. Some of the osteotomes commonly performed areas. One is McMurray's osteotomy for fracture of the neck of femur, and second is corrective osteotomy for deformities such as genu varum, bow legs, genu valgum, knock knees, etc. Now periosteal elevator. The periosteal elevator is used to elevate the periosteum. Elevation of the periosteum is necessary in all operation on the bone because all the important structures such as vessels, nerves, tendons, etc. are outside the periosteum, and therefore once the periosteum is elevated, the surgeon is in a safe plane. All the muscles of the extremities are attached to the periosteum and are lifted off the bone with periosteum. The periosteum is not elevated in some operations such as excision of osteochondroma, where the periosteum is excised with the osteochondroma to avoid recurrence. Periosteum elevators are different shapes and sizes depending upon their uses. Now another thing, this is the Bohler stirrups used for skeletal traction. Here screws securing the Steinmann pin, then nylon cord tied here, then Bohler stirrups, Steinmann pin. Bohler stirrups is Steinmann pin in situ, securely fixed by screws. Bohler stirrup is a device used for holding a Steinmann pin and applying traction. The screws on the sides of the stirrup are used to hold the pin. It is possible to change the direction of traction without moving the pin inside the bone, thus avoiding loosening of the pin. This is Thomas splint, metal oval ring, 2-inch angulation at outer bar. Parts of the Thomas splint consist of rings, medial bar and lateral bar. This is Bohler Brown splint. Bohler's modification of Brown splint consists of only one pulley. Pulley A, calcaneal distal tibial traction. Pulley B is distal femoral or proximal tibial traction, and pulley C, change of angle of traction. These are the three functions of three pulley A, B and C. A is for calcaneal or distal tibial traction, B is for distal femoral or proximal tibial traction, and C is for change angle of the traction. Stapler to arrest growth of epiphysis on one side and correct genu valgum or verum, arthroidosis in osteoarthritis or closed osteotomy. Then this is the bone nibbler. Bone nibbler is used for nibbling of the bone. It is available in various sizes and with different angles of the nose. Some of the common bone nibblers are straight nibbler for general use, curved nibbler for spinal surgery, and double action nibbler, that is straight or curved. The double action nibblers are mechanically superior. This is Josie's external stabilization system retractor, Charnleys compression device, Smith-Patterson nail for trochanteric fracture, used for internal fixation of fracture of the femoral neck. This is Jewett nail for trochanteric fracture, dynamic hip screw, angle of 135 degrees maintained for trochanteric fracture, dynamic compression plate, oval shaped, dynamic condylar plate. This is Sherman plate, 1/3 tubular plate, that is thin, moldable, and distal ulnar lobar tibia. It is used. Plates and screws, these are used for fixing two bony fragments. Different types of plates are available. This may be heavy duty, broad and narrow plates on semi-tubular plate. Screws may be used alone or in combination with a plate. Different types of screws used in the orthopedic practices are shown. In the past, machine screws, that is self-tapping screws, were used, but now AO screws, that is non-tapping screws, are used. A non-tapping screw is better than a self-tapping screw because in the latter, while tightening, heat is produced at the bone-screw interface, causing necrosis of the bone and thus loosening of the screw. For a non-tapping screw, threads are cut in the bone with a special instrument called a bone tap. So this is cortical screws, more thread, pitch and lead is less. Cancellous screw, less number of threads, pitch and lead is more. Screws are cortical and cancellous, fully threaded, used for diaphyseal fracture. 3.5 mm, that is radius ulna and fibula. 4.5 mm is humerus tibia femur. Cancellous, partially threaded, used for metaphyseal and diaphyseal fracture. 4 mm medial and lateral malleoli, 6.5 mm is condyle, tibial, femoral and fracture neck of femur.